everyone, Ryan here today for another herb talk. So let's go ahead and get started. Okay, so this week we are talking about Matricaria chamomila. Here are some photos of the flower and the plant. You can see the flower once it loses its petals. This may look a little bit familiar if you've been on some of the herb walks, as there is a variety of Matricaria that grows. It's oftentimes called pineapple weed, and you'll often see it with these yellow flower parts just like that. Okay, so some general facts. So the Latin name for this plant is Matricaria chamomila. The common name is chamomile, and the family is Asteraceae, which is also called Compositae. Some things about the Asteraceae family that are important to know. The main pattern is that there are unique composite flower heads in this family. So, and what this means is there's one flower head is made up of many smaller flowers, each attached to a pitted disc. So what you want to think about when you're thinking about this is the sunflower. The sunflower is in the Asteraceae family. It's that classic disc and ray pattern. So that the disc and then the rays, like the petals, that's the typical pattern found in this family. And there are actually disc flowers. So when you look at a dried out sunflower, you'll see all the seeds in the middle. Each one of those seeds was originally its own flower. So the center, the disc, is composed of several little flowers. And then each of the typical petals, which are what we call ray flowers, are also their own flower. This can be difficult to describe, but once you can visualize it, it makes sense. So basically, these are the disc flowers. You see all those tiny little disc flowers in there. And then these are the ray flowers. Okay, so as already mentioned, the flowers in the middle are disc flowers, and then each disc flower has 5 fused petals. You may not notice that unless you really start to take the flower apart and look at it. You will see all the 5 little petals. The biggest petals around the outside are the ray flowers, which are also their individual flowers. And a flower head must include disc flowers and or ray flowers in order to be in this family. And there are also multiple layers of bracts on several plants within this family. Okay, so the part used for chamomile is the flowers, and the taste of chamomile is aromatic and sweet with a mildly bitter aftertaste. So some of the constituents and pharmacognosy of chamomile. So it has volatile oils, and the main one that we know about is chamomile, which is known to be anti-inflammatory. This is a very well-known constituent, and I do recommend you are familiar with this. You might also hear it just referred to as azoline, but in chamomile, it's more specifically the chamomile. And this is relaxant and anti-allergenic. There's also matricin. This is a sesquiterpene lactone. And sesquiterpene lactones are known for being bitter, and matricin is responsible for the bitter action that chamomile has. And as a reminder, bitter action means that it stimulates digestive juices. So you'll oftentimes hear about people taking bitters before meals. It's to stimulate digestion. There are also some low amounts of salicylic acid in chamomile. Okay, so some actions and uses. Inflammation modulating. It's also anodyne. It's a wonderful nervine, meaning it calms the nerves and the nervous system down. It's tropho-restorative to the nervous system. And when you see the term tropho-restorative, it means it's restoring normal function. So it's bringing balance, whether the nervous system is hyperactive or hypoactive. It's a digestive bitter, as we just mentioned. It's a carminative, meaning it relaxes the smooth muscle, particularly smooth muscle in the GI tract. And that's why carminatives tend to ease gas and bloating. And it can also aid in restlessness before sleep. And you'll be covering this plant in Materia Medica in your GI section, mostly for that digestive bitter and carminative action. Some of the energetics of this plant, it's cooling and moistening. It's best employed when the spirit of a person has been upset and is manifesting physical ailments. So think of those patients who went through some sort of emotional trauma or experience, and now they have different physical symptoms occurring. It's also really wonderful for calming anger. Some contraindications. So rashes are possible with any plant in the Asteraceae family if the patient is allergic to Asteraceae plants. So always make sure to check your allergies with your patients. So if they have an Asteraceae allergy, you don't want to give them chamomile. Also, there's increased risk for asthmatic attacks in those who have asthma and are allergic to Asteraceae. And also high doses in early pregnancy are contraindicated. Although chamomile is a plant that's sometimes used throughout the later stages of pregnancy, it's also common to use in babies. And some resources. So I just wanted to read you a brief excerpt from the Earthwise Herbal about chamomile and its use for babies, because this is a very common botanical for pediatrics. And so it says, chamomile has a long history of use in folk medicine as a sedative for cross, whining, irritated babies, and the problems incident to babyhood, such as teething, earaches, and intolerance to pain. The child is peevish, whining, complaining, angry, demands attention and petting, demands a toy, then throws it on the floor. Whatever the age, the behavior is unmistakable. Babies of any age, as I say, petulant, self-centered, intolerant of pain or not having their way, inclined to pick quarrels, yet averse to being touched, soothed, or spoken to. It is not suited to infants or children, but to babies. And this does note that Sambucus is more indicated for babies, while Cichorium is more for children. Sorry, Sambucus is for infants, not babies. In health, the chamomile person is as sweet as a baby. So I just thought that description was kind of interesting. It's also pretty similar to the chamomile description that you'll learn about when you get to homeopathy if you're not there yet. So it's nice to be able to compare some of the botanical indications as well as the homeopathic indications there. All right, that wraps up everything for this herb talk. We'll see you next time. Bye.